Hello, I'm Dr. Rachel Hall of Evolved Dental Healing. I'm a holistic dentist. Our practice is in Brisbane, Australia. And I just want to thank you for joining me live. And tonight I'm going to be talking about TMJ, headaches, neck pain, and your bite and your health. So I'm just going to wait for a few more people to pop on. And while I'm doing that, I just want to thank everybody who joined us live last week and also watched the replay and shared our fluoride video. We've had 9,000 views in a little over a week, and to me that's quite amazing. I'm very humbled by that. I'm very privileged to be able to get the message out there. It's obviously a hot topic, and I think it's definitely one we'll need to revisit. So tonight I'm talking about TMJ's headaches, bite problems and airways. I won't go into airway too much today. I think we'll save that for another video, otherwise this will be on for about 2 hours. So thank you for joining me live. Lovely to see the Europeans here. Hello Alexandra, hello Caroline. Thanks for joining us. If you've got any questions or you just want to say hi and share where you're from, then please pop that in the comments. So thank you for watching live, and if you're watching the replay, it's really appreciated. Thank you for your time. So tonight we're going to be talking about TMJ. Now this is something I can personally relate to, having suffered from headaches and migraines, neck problems and TMJ issues myself. Hello Vanessa, great to see you here. Thank you for joining. And so I see many patients who come in and they tell me they've got TMJ. Well, to be honest, they'd be right. In fact, they've got two. You've got one either side here. The TMJ is actually the shortened name for the name of the joint, which is the temporomandibular joint, if we want to be technical. So this is the joint that's responsible for you being able to open and close your mouth, for talking, chewing, kissing, swallowing, and even breathing. It also plays a part in your posture. There are a lot of fibers in your jaw joint that allow you to know where you are in space, so that when you close your eyes, you don't fall over, for example. So what people actually mean when they say they've got TMJ is that they've got a problem, usually some pain with their jaw joint or difficulties with it functioning. Now, many head and neck problems are caused by TMJ disorders or an airway, a breathing disorder, or both at the same time. A bad bite can also affect your whole posture and your bodily, how your bodily organs function. Hey Yasmin, hello Bernadette, great to see you here. Thank you for joining. If you want to ask any questions, or you've got any comments, just pop them in the comments box. Thanks for joining us live. I'm Dr. Rachel Hall of Evolved Dental Healing, talking about TMJs and headaches. So as I was saying, a lot of head and neck problems are caused by TMJ difficulties, by a misaligned bite, and that can affect your posture and the way your body functions. So there are well documented symptoms that can be caused by TMJ issues, or be causing the TMJ to feel like it's the source of the problem. So it's very difficult for us as dentists to effectively diagnose and properly treat the problem, because we have no sure way of knowing if your symptoms are coming from a misaligned bite, an overworked bite, or whether it's other factors. So you could have, for example, flat feet, one leg longer than another, hips out of alignment, some issues with your spine, and that can cause pain in your face and the TMJ region. But that's not the initial cause of the pain. So if we're treating the TMJ and we're not addressing what's going on in the body, you're not really going to get any better. So it's a difficult chicken and egg thing. It's like, is the TMJ the problem, or is it something else? And essentially it is very, very difficult to tell, and sometimes it's a case of trial and error. So you might be having pain in your jaws, and those issues can be elsewhere, and as I said, the root cause is not the TMJ. So how do we know, for example, you don't have fibromyalgia, some sort of allergy, mercury toxicity even, Lyme disease, or an underactive thyroid? And these can commonly exhibit the same joint pains and muscle pains and sleep disturbances and headaches, difficulty concentrating, and sometimes numbness and pins and needles down in your arms and hands, and brain fog, etc. So it all comes down to posture, balance and motion. Our nervous system coordinates our motions, both the ones that we want to do, so like the voluntary ones, like me saying I want to lift my hand up, I want to move my head, I want to talk, or the involuntary ones, so those that you don't have to think about and they're happening in spite of you, so like your heart beating and those sort of things. So the nervous system signals from one part of the body to the other. And your nervous system is responsible for biofeedback, so knowing where you are in space. Like I said, so your body stays upright, so you don't fall over, you don't fall out of bed. So even when you close your eyes, you don't collapse in a heap on the floor, because your body, through the nervous system, is telling you where you are. And so you can then adjust your balance without even having to think about it, so that you stay upright. So we have a high volume of these receptor nerves in our hips and in the TMJ, or the jaw joints, that are responsible for what we call proprioception, which is that feedback that tells you where you are. So you can shut your eyes and you can put your finger on your nose, because you can sense where you are. And these help us maintain our posture and our balance. So your nervous system needs to be in really good shape for it to communicate properly. And that depends on nutrition, the foods that we eat and the foods that we choose not to eat, and neurology, so how the brain actually processes the information, the endocrinology, how your hormones regulate your body, and stress, so how we handle chemicals that are released from stress. So the body is designed to be in harmony and for it to have balance amongst all of its parts. So your organs are meant to work together. There shouldn't be one that's overactive or one that's underactive. Your nervous system shouldn't be running on overdrive all the time either. So your body's designed to work as a whole, with all of its parts balanced and equal. When there's an imbalance, that's when we're going to get dysfunction, we're going to get breakdown in the body. And the problem is, in modern medicine, which I'm a big fan of and it does a great job, is it's become very compartmentalized and reduced. So we've become very, very specialized at treating the parts and forgetting to look at the whole. So in dentistry, in this small area of your body, we have specialists in gums, specialists in jaw joints, in the roots, so doing root canals, and we have specialists in teeth alignment, specialists in taking teeth out and dealing with jaw and cancer problems and that sort of thing. So you wouldn't expect in dentistry we could be that reduced, but this is what's happened in medicine. So you've got your heart specialist, your kidney specialist, and so forth. And so they're all busy treating the parts, and they do that very well, but they're not looking at the whole picture. And this is where holistic health and holistic dentistry come in. So I just want to thank everyone who's here live. Please, if you're enjoying this, give us some love. Push that little hearts button. If you really like it and you're getting some value and you think your friends might enjoy it too, then please share, get the message out there, leave comments, ask questions. So you might be going to the doctors saying, I don't feel well, there's something going on with me. And you've been told there's nothing wrong and all your tests come back normal, but you know you don't feel right. So you have to start wondering, could it be that your issues could come from something as maybe as trivial but not so trivial as a faulty bite? I've seen it, so let's look into this. So I'm going to talk about the TMJ today, and I think I'll discuss airways next time, but they do go together because your mouth's part of your airway and your breathing. So they involve the same structures. They involve your nose, your mouth, your throat and your jaws. And I always joke that TMJ is teeth, mouth and jaws, because really it is about everything. Can't fit nose in there, it doesn't go with those letters. Anyway, these are super complex and moving structures. They're made up of bones, muscles, teeth and organs. Your tongue is actually an organ made up of lots of different muscles and sensory things so that you can taste and you can talk, and connective tissue as well. And connective tissue holds everything together. There are many, many nerves in the face, and these coordinate and send signals so that everything works together. It's like an orchestra playing a symphony. It takes many moving parts to get the tune and get it playing in harmony. So your TMJ and airway issues are interrelated. They're like the reverse sides of a coin. Each condition has to be treated differently yet they have similar factors and symptoms, and that's why it's very hard to separate them and do one conversation about TMJ and one conversation about airway. So the TMJ, which are these joints here on the side of your head, they connect the lower jawbone to your skull just in front of your ear. You have matching joints on either side of your face, and they're meant to work together like a hinge. So it's a little hinge joint that goes up and down, and they have to work smoothly and in harmony with each other's. There are multiple muscles responsible for making that jaw joint move. And inside the joint, there's a tiny little disc of cartilage between the top of the joint and your skull. So you've got muscles that clench your jaw, you've got muscles that open your jaw, muscles that make it move from side to side and back and forth. And these are all interlaced around your skull and your neck. So it's thought that your jaw joint is the joint that's most used in the body. So we talk, we chew, and we swallow. We swallow about 3,000 times a day. And every time we swallow, the jaw joint moves, the teeth come gently together, and the jaw joint compresses against the disc between itself and the base of the skull. So every time you talk, chew, kiss, swallow, and even breathe, you are using this joint. So at the back of the joint, I wish I had a little anatomy book here. I'm actually at home, so I don't have any of my dental things here today. At the back of the joint, there's a band of soft tissue. It's like an elastic, and its job is to pull the little disc that sits over the joint back into position as you open and close your mouth. So as you open, the disc moves, and then it pops back as you close. But what tends to happen with all that movement is that bit of elastic tissue can get damaged very easily, and it can be responsible for a lot of the pain that you experience in TMJ disorders. So pain in the head, neck and face can be caused by inflammation of the muscles or nerves, or damage to the nerves themselves, like you get in a whiplash injury. They occur mainly when the joints don't function harmoniously and smoothly. So if you've got a misaligned bite, or you're not symmetrical, which most of us aren't, your upper jaw can be sitting, hard to do this on camera, there we go, your upper jaw can be sitting on an angle rather than flat. So when it's on an angle, it means your jaw joint sits on an angle as well. So instead of it opening straight up and down, it's going off to the side, and then your other muscles are trying to pull it back into alignment. So you're getting this rocking motion going on in the joint, which is making it move in an incorrect way, and it makes it wear. It pinches on the nerves and the fibers and the muscles. You get damage and inflammation, and then you get pain. So when they don't function harmoniously, many systems are involved. So the bones, the muscles, the teeth, and nerves, and problems in that area can have a knock-on effect to your health. There are many, many reasons why we can have problems with the chewing muscles and the jaw joints not working together correctly. So your bite can malfunction due to improper growth, accidents and falls, lack of dental care, misaligned teeth where our jaws don't grow properly and our teeth become crowded and they don't meet together properly, and also overload. And the most common cause of TMJ problems is from clenching and grinding. So thanks everyone who's here live. Thank you for watching the replay. We're talking about TMJs and headaches, and just getting a little bit of insight as to what that does health-wise, and I'll hopefully get some time to talk about what options there are for treatments as well. So people who have a misalignment or an incorrect relationship between their teeth and jaws have what we call in dentistry a malocclusion, which basically means backbite. So that means that your upper and lower teeth don't meet properly, and so you don't have the right support for the jaw to counteract the pressures and forces it needs to withstand. So this can happen when you have missing teeth, or teeth that are a bit too short and too long for the way your face has grown, or a size difference between the upper and lower jaws. So this causes the teeth to overcrowd or come together in an abnormal bite pattern. So it's interesting, and you'd think that, well, if that's the case, then everyone has got a wonky bite, and isn't that most of us? would automatically develop TMJ problems, and that's not always the case. I guess it depends on our propensity to get inflamed and damage the nerves, and how well our system's being cared for, and whether there's any other compounding issues structurally in the body. So the most common reason for a bite malfunction is a trauma like a car accident, or from the ongoing trauma from clenching and grinding your teeth, which is called bruxism. And even things like fingernail biting and pen chewing, these habits are pushing your jaw into positions that it's not designed to go in, and putting forces and pressures on the teeth and the muscles on a continual basis. So you often say to patients, I can see that you clench and grind, and the first thing they go is, no, I don't. And I go, well, it happens while you're asleep. So how do you know? Because do you know how many times you roll over in your sleep? Do you know whether you snore, etc., etc.? Because you're unconscious. So clenching and grinding is happening unconsciously, and you move your jaws and your teeth together while you are sleeping. Now, it's normal to do that while we're in what's called REM sleep, which is where we're dreaming. But it's not normal to do that over and over and over during the night, and to be doing that night after night. It's like hopping up and down on one leg continually. So this clenching and grinding wears to your teeth, leads to your teeth chipping and wearing, and you can even crack or split teeth. I've seen people where a very healthy, strong tooth has actually split in two. It's never had a filling or decay, and it has split completely in two, and we can't save it from the pressures of clenching and grinding. So not only does it damage the teeth, it also makes your gums recede, and it accelerates bone loss and damage associated with gum disease. So imagine you've got a fence post in the ground, and you're holding it and you knock it from side to side. That fence post is going to start wobbling and going backwards and forwards, and that will loosen the soil up around that fence post and start to open it up. And it does the same in the jawbone. So you've got the tooth rocking from side to side under immense pressure, and that starts to destroy and damage the jawbone and makes the gums recede. Now, if you've got gum disease that's not treated, those combined together are going to give massive bone loss and problems very quickly. So there you are, and your dental hygienist is scolding you for not flossing enough and having inflamed gums, or you're told it's because of your menopause and you've got low estrogen, or it's stress, you're low in supplements and vitamins, you're not eating properly. And yes, those are all factors in gum disease. But if you're grinding and clenching your teeth, then all the while you're knocking your teeth around and you're loosening up the gum and bone, just like I said, hitting that fence post in the ground from side to side. So if we don't treat the TMJ issues and the clenching and grinding, not only are you going to have headaches, sore neck, probably sore lower back, and also pain in your face and difficulty opening and closing your mouth and chewing, you're also going to be accelerating any gum disease problems and actually potentially prematurely losing your teeth because of this ongoing impact night after night. So to properly diagnose TMJ issues, you need the knowledge to be able to interpret what you're seeing as a dentist, and also getting a good history from the patient, so understanding the backstory. And this allows us to put the pieces of the puzzle together. So thank you for joining us live. Hey Joe, great to see you. Nice to have some dental people on board tonight. Thanks for joining us live, and thanks for watching the replay. So I'm just talking about TMJ, which is the joint that you chew with and talk with. So the most obvious signs of TMJ issues are worn, chipped and fracturing teeth, but often pains can be elsewhere, and you can get pains that strongly mimic toothache, to the point where it's really excruciatingly painful. And so I've seen patients who have ended up with needless root canal treatments or tooth extractions, only for them to keep going back to the dentist saying that pain is still there. It's exactly the same. It has not gone away. So we've got to get better as dentists at working out what's going on so we can actually do the right thing. So TMJ disorder, it's progressive. It's going to cause inflammation and arthritic destruction of the head of the joint. So that's the bit where it rubs against the skull. When your jaw is not aligned as it moves, it causes a series of what's called compression injuries. So this will even happen when you're swallowing. It's squashing that jaw joint and all the fibers and tendons and nerve endings together and causing inflammation. Now, when the joint's not aligned properly, the disc of cartilage that sits between the skull and the jaw joint bones, it tends to slip forward and it makes this clicking or popping noise. Now, without that cartilage sitting between the bones, they end up rubbing against each other and they press directly on the nerve endings. And when that disc pops out, we call that a dislocation, and then it pops back in. But it means that every time you open, you've got bone rubbing on bone. So you can often feel that click or popping as well as hearing it. So if you put your fingers just in front of your ears and then open and close, you can sometimes feel that click and movement. You can even put your fingers just inside your ear, and you get to feel the back of the joint moving, and you can often feel it rubbing and together. So Yasmin's just asking me, well, what underlies that clenching and grinding? And a lot of dentists will tell you it's stress, and so will a lot of practitioners. Stress does not cause you to clench and grind. It actually means that you do it more and you notice it more. So if you're frustrated, then you're gritting your teeth together, and you might be doing that in your sleep as well if you haven't dealt with what it is that's getting you mad. So with the jaw joint, if the pressure is great enough, the cartilage can break down and deteriorate. And then you get this gravelly or grating sound when you open and close your mouth, and that is definite bone rubbing on bone. And now you have a situation where your bone's actually melting away from friction and inflammation. So once your jaw displaces, and you get muscle spasms, because those muscles are trying to hold everything in the right position, and you get the nerves stimulated, and that causes pain around the head, neck, jaw and shoulders. Can you imagine everything's just holding really, really tight to stop your jaw wanting to swing all over the place? So it can often mean that you can't open your mouth very far because your muscles are so tight. You should be able to, I believe, comfortably fit 3 fingers between your teeth when it's open. Now, I've got some TMJ issues, so I don't actually think I can do that, so I won't try and demonstrate. So when those muscles get really tight, you can have difficulty opening. So Caroline's just asking, when you have that popping, you find the mouth doesn't want to open completely and it needs to be forced, and then a big pop happens. Is this jaw displacement? Yeah, sometimes it's best not to push too far and fully open, because you can be dislocating it further. But some people find if they open too wide, they can't actually close back in because that disc is getting trapped. So it's very important, if you're finding you're getting that locking thing, that you do go and get it addressed so it doesn't deteriorate and leave you in a situation where you can't close your mouth. And I would recommend not doing big yawns or big stretches, or if you're eating something like a burger or an apple, that you don't do that big thing and get stuck there. So you get the muscle spasms, and you get the unhealthy nerve signals generated as your teeth are contacting each other when they grind. Those signals go up to your brain through a large nerve called the trigeminal nerve or cranial nerve 5. And this is the longest and most complex of the cranial nerves, and it signals a part of your brain called the limbic system. Now that's kind of our area where it's responsible for our emotions, the fight-flight reaction, and this creates a heightened state of anxiety and nervous tension in the body. So you're clenching and grinding, and it's making you more and more anxious, and so the body's actually in this revved up emotional state. So while you're sleeping, hey Nathan, great to see you here. Thanks for joining. So just everyone who's here live, once again, many thanks. If you're watching the replay, thank you. If you're enjoying this, then share the love, give us some hearts. Facebook likes that. If you're getting a lot of value out of it, then please do share. Let's educate people about what's going on with their dental health and their overall health and how that connects. So while you're sleeping, you're not supposed to be grinding and clenching your teeth. You're supposed to be resting. And this is allowed then your body to recuperate and regenerate from the day and to stop your nervous system being on high overdrive. So if you're clenching and grinding your teeth and creating that fight, flight and emotional anxiety response, your adrenal glands are pumping out stress hormones, the one called cortisol. So your adrenals can get burnt out and so do you. That constant physical stress triggers muscle activity, which can create overload and pain all over the body. So then, as if it couldn't get any worse, your body almost needs that level of stress to get through the day. So you clench and grind during your waking hours to give you that hit that your body needs. No different to someone who needs sugar or caffeine to keep them going. They get that up and then the low, and then they've got to feed it again. So it's the same with this clenching and grinding. Your body's actually seeking it to stimulate that nervous response to keep you in that fight flight. So you might actually find that you're gritting your teeth together during the day or grinding them and you suddenly catch yourself doing it. I know that I sometimes catch myself when I know I've had a bit of an issue with my TMJ and I haven't been as good at wearing my night splint as I should be. Yes, even us dentists are human. And I'll find that I'm driving and I've got my teeth gritted together, or while I'm working at the computer. So I get very aware of my body, aware of my breath, and choose to breathe gently and just let my body relax and become gentle and let go. So that constant repetitive excessive pressure on the teeth will actually cause the bone around the root ends to overgrow. A little bit like when you work your hands hard, you'll get overgrowths of skin, like a callus there to try and counterbalance that pressure and force. So the bone around the tooth can actually overgrow, and that can also happen in the roof of the mouth. That can cause it to do the same as the roof of the mouth is flexing like this under the pressure. You can get a big thickening of the bone in the middle on the roof of your mouth. So this can also happen in the lower jaw, and you'll get nodules behind your lower front teeth, for example. So as well as this bone overgrowth, you can actually fracture and split the roots of the teeth. Now, if that happens, they have to be extracted. So you can see that clenching and grinding is not something that we should just dismiss. So when your dentist says you grind your teeth, you should go, well, what are you going to do to help me? What can we do to protect my teeth and jaws and stop me going down this avenue of having extreme pain in my face and maybe the rest of my body, and also destroying your bone around your teeth and making your gums recede? So let's go back to cranial nerve 5. Thanks, Caroline. Thanks for joining. Obviously, come back and watch the rest of it on the replay, and you can get some more information. But if you've got any questions and you want to type those in quickly, I might just answer those at the end for you. So yes, I know everybody wishes that I was a bit more in their country than just over here in Australia. So yes, I will be getting to some hints and tips a little bit later today. So back to cranial nerve 5. This is the root cause nerve for migraines in many people due to the changes in the way the nerve signals. And this drops the serotonin levels and causes pain. So one clear thing is that if you suffer from migraine, you don't want to be stirring up and stimulating that 5th cranial or trigeminal nerve. You don't want to be clenching and grinding and putting pressure on that during the night, because it is going to trigger more migraines. So how do we diagnose TMJ dysfunction if it's so difficult to work out exactly where it's coming from? So often you're going to go to the dentist and you'll tell them my tooth is painful, and they examine it, test it, take x-rays, and they tell you everything's fine, you've got no cavities. Yet, if they were opening their eyes and taking that whole picture example that we talked about earlier, and not just looking at the parts, then if it looked a little bit further afield and opened their eyes and looked beyond the tooth that you say hurts and looked at the rest of your mouth and teeth, they'd see shiny, flat wear areas on your teeth, wear notches in your teeth near the gum line, and stress lines in your enamel. They'd also, if they took an x-ray and looked at the bone in between your teeth, it can show changes of bone damage and bone loss that are classical to teeth grinding and in TMJ sufferers. Hey Sonia, good to see you here. I'm just going to get Jared here. Hey Jared, thanks for joining me. So Jared says he notices when he wakes up with headaches in his temples, and his grinding comes and goes with stress and unhappiness at work. I should really get a mouth guard. Well, a mouth guard is for sport, but I know what you mean. You mean a night guard. Yeah, and they're designed to stop that pressure and spread it out a little bit more and ensure that you're not crushing the jaw joint up against the base of the skull. So yes, if you're noticing those sort of symptoms, and particularly if you're waking up with headaches, that's a real giveaway that you're clenching and grinding. So sometimes when we're looking around the patient's mouth, it's really obvious that they grind because the enamel and the teeth themselves can be worn very flat where they rub against each other, or there can be cracks and fractures in the teeth get broken fillings. So you have to remember that the enamel is the hardest thing in the human body. So to see this kind of damage should be really ringing alarm bells for your dentist. It's not something that we should be ignoring or trivializing or saying we'll monitor that and see what's happening. You know, it needs to be addressed. So many teeth grinders and clenchers will have worn areas on their teeth down near the gum line, like little semicircles. And these are not from decay, and they're not from over scrubbing your teeth. You regularly see patients that are told they're wearing their gums away and making them recede because they're brushing too hard. And I personally think that's completely wrong. I believe that it's a sign that that person is having clenching and grinding issues. So whether that's from an airway or breathing disorder or from a TMJ problem, we should not be saying to our patients, you brush too hard. So I have, think about this, and this is what I was trained, it's from over scrubbing. So I started to wonder, well, if you're brushing too hard, why are you only wearing the teeth away around the necks of the teeth at the gum line and nowhere else? Wouldn't there be damage more over the mouth and grooves in other parts of the teeth? So yeah, that's where I started to question that. So those notches down at the gum lines or up at the gum lines are formed by excessive pressure from grinding that is flexing your tooth. It's actually breaking the enamel off at its thinnest point, which is where it joins the root of your tooth at the gum level. So those forces are going to be creating bone loss in your jaw. It damages your gum tissues and it leads to loose and mobile teeth. It can make deep pockets or gaps that form along your roots that allow bacteria to grow down there and destroy more of the bone, just like gum disease does. So when I'm examining my patients, regular checkups and new patient comprehensive inspection, I'm always looking for these signs. I look at every patient, whether they've got pain or obvious symptoms of TMJ issues or not. I'm going to be looking for clues to be able to know precisely what's going on, to be able to diagnose, prevent or treat any underlying problems. So I'm also going to, as well as look at the bite, I'm going to perform a muscular examination of every patient and my comprehensive and routine check. I'm going to feel the movement of the jaw joint like I showed you earlier in the video, and I'm going to squeeze and feel and touch the muscles that are responsible for clenching and grinding and chewing. So when I do this on someone who grinds their teeth, I can feel how tight and enlarged the muscles are. And I can feel that there's tenderness, and often there can be a discrepancy from one side of the jaw or head on the other. And that hence when you look at the wear on the teeth, cracking, broken fillings, notches at the gum line, bone loss around the teeth, bone overgrowth in the jaws, and you can feel tight muscles that can be tender and actually be quite painful just to the lightest finger pressure. If you hear clicks and popping, or the jaw doesn't move evenly as it goes up and down, you can see that there's a pattern starting to emerge of the telltale signs of this person clenches and grinding, and that makes me pay attention. So there's usually a pattern of painful areas in the muscles called trigger points. And these are bunches of contracted muscle fibers inside the muscle. And you have these trigger points in your head, neck and jaw, and they can send pain to other parts of your body. So you can be pressing on something and it can make the hip or the lower back hurt. And that's why sometimes people will have low back pain, but it's actually the jaw that's the cause of the problem. So if I suspect any TMJ or sleep breathing issues, I'll order a specific x-ray called a CBCT. That's a cone beam computer tomography. You can see why we abbreviate everything in medicine. And these are special images that allow us to see the TMJ joints inside your nasal passages, your sinuses, the throat and the airways. We can look at the spine area in the neck and also the teeth all in one go. Now these are 3D x-rays and we can turn them around and we can look inside out and we can look in sections, so I can go this way through the head and this way through the head, and I can see so much on those, and these help me correctly diagnose your issues and treatment. So this is the bit that most people wanted me to get to and have been asking questions, so thank you for being patient. Thank you for watching us and joining us live. Thank you for watching the replay. If you're enjoying this and getting value, please share some love, press the hearts, and also share the video. So the good news is we can treat this and we can repair your faulty bite by creating an even spread of pressure over all your teeth and biting surfaces. So we can do simple things like maybe just reshaping some of the teeth, building up teeth, either with filling material or putting crown covers on the teeth. We can use orthotics or orthopedic devices in the jaw and night guards for your jaw that you're going to wear, as it says, at night. And we can even do orthodontics to correct the position of the teeth. So what I do is, this is a multidisciplinary team approach. So we're going to make sure we explore every avenue and we make sure that we're not jumping to conclusions. So I work with a really highly trained team of head and neck physiotherapists, which just happen to be a couple of suburbs away from where my dental office is in Brisbane. And so they help to reduce some of the muscle spasms and retrain the way you're holding your head and your jaw and your tongue. Also going to be giving you some breathing exercises to support with the jaw position. And then I'm going to provide orthotics or the orthopedic devices as the first stage of TMJ treatment. And this is to balance the bite and do what we call decompress the jaw, which is a way of removing trauma off the jaw joint. So a bit like if you've sprained your ankle, we're going to ask you to rest it and not walk on it. Well, it's not that easy with the jaw joint when you look at it's involved with everything that we do, from breathing, swallowing and talking. So we want to protect that jaw joint from getting knocked and creating more inflammation. So you need to be able to rest and recover it. So even just a small swallow is enough to keep your jaw joint inflamed. So the orthotics are worn usually over the lower teeth, and you wear one during the day and then you wear an upper one at night time. So they're worn over the teeth and they're worn for a period of about 3 to 4 months under regular review. And this allows us to treat the muscles in the jaw joint. Once that's done, we need to address the misaligned bite and prevent relapse and any further damage. I'm also going to recommend support with anti-inflammatory medications and supplements and dietary changes that support healing and reduce inflammation. So we're going to put you on what we call an anti-inflammatory diet to support the healing in the joint. So usually after about a period of 4, 5, 6 weeks, you'll know if your orthotic's been successful. And this is actually when the biggest improvements begin to occur. You actually see some big shifts in people's symptom reduction in that first few weeks. And this is with no drugs and no surgery. It's just by positioning the bite to be in its position of ease, where the jaw feels comfortable, there's no pressure being put on the joint, and the muscles, ligaments and nerves aren't getting stressed and inflamed. So if you've listened to this information and you think you might have some TMJ issues or any signs of clenching and grinding, please don't wait until it gets to a point where you're in severe pain or having lots of dental issues and getting regular headaches until you get your teeth and jaw properly checked over. because the longer the condition is allowed to go on, the more damage and inflammation there is, and the longer and harder it's going to take to unravel it. So if you think you've got a TMJ issue, please get it checked over, find out exactly what's going on, because it's going to be simpler and easier and less expensive to treat in the early phases rather than waiting until you are like a lot of patients that I see who come specifically for TMJ issues, where they're in pain 24/7 to the point where it feels like someone's sticking a knife in their face. So Jared, yes, that's a real sign that those front bottom teeth are all flat at the top, and particularly those canine teeth. Your canines should come up to a nice point. If they're flat or even going the other way where they're actually getting dipped in, I'd say you've definitely got some signs of jaw joint issues there and grinding. Yes, is it Margarita? Sorry, the print comes up a little bit small in here. Yes, I will be talking about how to get mercury fillings in a good way. That's going to be coming up in some later episodes, and I'll make sure that we do talk about that. But tonight I'm going to focus on TMJ so that we can stay on topic. But yeah, there are ways to get rid of those mercury fillings safely, and you need to make sure that you're finding a dentist who understands how to do that. Look for someone who's what's called SMART certified. That's a really good starting point. If you do some good Google searches, you'll be able to find some holistic dentists who actually know what they're doing and can do that safely for you. So as I was saying, if you think you've got some TMJ disorders, don't wait, don't put it off. Get it checked out and get some treatment now before you end up in severe pain and debilitated through this condition. So thank you very much for joining us live. Thank you if you've been watching the replay. Thanks for everyone who's commented and asked questions. It's really fantastic. I really appreciate you doing that. It makes for a much more interactive video. If you do have any questions about TMJs, headaches, or any other topics that are dental related, then please just leave a comment in the chat and we'll do another video. So I'll definitely do a video on getting rid of mercury fillings in the upcoming weeks and explain how we do that safely and in a good way for you. Next week I'm going to talk about airway disorders, snoring and sleep apnea, because it really ties in with what we've been talking about tonight with TMJ issues. So thank you very much. If you do think you've got a TMJ issue and you'd like to get it checked out, I'd be more than happy to see you for a consultation and examination. So please feel free to give us a call at Evolve Dental. Our number is 0737201811, or you can check out our website and email us info@evolvedental.com.au. So I'm Dr. Rachel Hall of Evolve Dental Healing in Brisbane. I'm a holistic dentist, and I've been sharing about TMJ and headaches and the impact that has on your health and well-being, and some ideas on how we treat that. It is a complex subject, so I can't give an exact this is how we treat it. It has to be an individualized approach. But I hope you've got some value from this tonight, and that you've really started to look at what's going on in your teeth and mouth and start putting the pieces of the puzzle together. Thank you very much, everyone. See you next time.